Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. One of the hallmark symptoms of post-traumatic stress disorder is intrusive traumatic memories. Conventional therapies typically require explicit and emotionally distressing re-exposure to trauma cues, and that can lead to high dropout rates among patients. My guest today will talk about an unconscious intervention that might help. Dr. Chunyu Liu is a professor of psychiatry and behavioral sciences at Upstate. Welcome to The Informed Patient, Dr. Liu.
Hi, thank you for inviting me to the show.
Now, you're a scientist, you don't see patients, but you're working on something that could help the clinicians who do see patients. What is this unconscious intervention?
Basically, the thing we learned in treating the PTSD patient is that one of the conventional methods to treat PTSD patients, you have to expose the patient with traumatic imaging, video, so they can re-experience some of those trauma under like a controlled, safe condition. So gradually, you train them to reduce the response to those kind of trauma. I think that's the logic or principle of those kind of methods. But we know those responses can be very dramatic, can be very painful. So frequently, they cannot live through those procedures again. And they drop out. So they will not continue the therapy. So the solution we are thinking is maybe we can use a procedure, expose patient to those events in a more minor way, subtle way, so they would not even recognize they have been going through those exposure. By doing that, they will not feel as painful, but adjusting the response internally. I think that's the whole principle. So we'll provide image in this case, just very short time flash of the image. They see the image, but they did not recognize they have seen the image. Then internally, they adjust subconsciously. And we see the effect, they really have reduced the response, and they can tolerate the procedure. They can show improved symptoms. I think that's the whole idea.
So there's a way that you can expose them to this traumatic event or episode that they experienced without them really realizing that they're being exposed to it.
Right. The trick is basically it's like a play movie, right? When you see the image long enough, you recognize it. You realize you're seeing the image. But we set a very short time for the image. We control for milliseconds, right? These thresholds vary by individual. Some people are very sensitive. They see a flash of image, they recognize it. Some people need a little longer time to recognize the image. So we need to adjust that time for every individual and then determine this is a threshold for that individual. Then we flash the image. So that's the image provided by the patient, considered to be the traumatic events cue. Then we flash those images along with noise, white noise. Basically, you do not see anything, right? You do not see anything related to the trauma. Going through that procedure, then you are exposed to the image without knowing you have been exposed. So that's the trick.
If you can help me understand, this is a therapy session, let's say, between a patient and a provider.
Yes.
Are they watching a video together and these images are just interspersed?
Yes.
I see. Now, I've heard of eye movement desensitization and reprocessing, EMDR. Is that what this is?
No, this is the modified version. The standard one would not involve this exposure. It's just that the eyes have to follow the therapist, so hand movement cue, right, during the treatment process. I think that's a major requirement in that process, but we modify the exposure. I think that's a major modification we have.
I see. Let me ask you to please define what post-traumatic stress disorder is. What sorts of experiences may cause a person to develop PTSD? I think we hear about it when we think about military action, but that's not the only place that this might be an issue, right?
Exactly. Yes. Many people live through all kinds of traumatic events, nature disaster, hurricane, volcano, right, tornado, rape is another major one. Well, certainly war is a major one. So all those very traumatic events can cause PTSD in about 1/3 of people. Not everyone will have problems, just about 1/3 will develop PTSD. The major symptom is they have like a flashback memory. When they hear sound, when they see certain things, the memory jump back, a very scary one. So that can lead to sleeping problem, depression, anxiety, and so on.
Do doctors prescribe medications for PTSD sometimes?
They do, but mostly for controlling symptoms, depression, anxiety, and sleep disturbance. There's no really good medication to treat the intrusive memory issues. So you have to count on this kind of exposure treatment.
So is the unconscious intervention meant to replace or to augment conventional therapy?
Yeah, that's the goal. We do hope this method is more gentle so the patient can tolerate the procedure better. But for the time being, this is just the first pilot study with a few individuals. We do need to scale it up in one more patient. Another challenge is right now, we do have to count on the patient to provide a specific traumatic image so we can use that for the treatment. And that's the tricky part. So it has to be individualized. So right now we are trying to find a better way to generalize, standardize the procedure so it can be used to more patients.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Professor Chunyu Liu about research into treating some aspects of post-traumatic stress disorder. You and your co-authors recently published a paper about your research in the Proceedings of the National Academy of Sciences of the United States of America. Can you walk us through the experiments that were conducted?
Basically, we recruit patients. That's a major experiment. We recruit patients of PTSD and have them go through the procedure. One is the unconscious exposure procedure. Another one is just regular. They recognize they have been exposed. So we compare the difference, right? And we have a control individual. Then we have that procedure 2 consecutive days, session per week. And we do that 2 weeks. Then we follow them up in another week. Then we see whether that treatment effect can last longer. So that's basically the major experiment we've done. Then we evaluate the improvement in terms of the intrusive memory recall. So those are the core experiments we've done for PTSD patients.
So did the unconscious intervention reduce the frequency of intrusive thoughts in your study?
They do, yes. We do have all the numbers. I don't remember exact number here. We have like 67% reduction was the first baseline. It's basically before they went into therapy. They have like only 20-30% intrusive thoughts after the treatment. Then if you compare to control who do not went through the procedure, that's about 50-60% reduction.
And how long do the effects last?
We have 2 months follow-up and prove the effect still lasts, but we don't have longer follow-up. It will be important if we can recruit more patients.
Well, it sounds encouraging, but I wonder, do you think it will ever be possible to completely remove memories of trauma from someone with PTSD?
Personally, I don't think that is really possible until you develop like dementia. You forget everything completely. Otherwise, the memory will still be there. You just try to reduce the response to those signals, to those cues. I think that's the goal.
Is it typical that PTSD would be something a person struggles with for lifetime?
I believe so. Yeah, it's part of your memory.
And is it typical that it may be sort of under control for a long period of time, but then it might come back where you're suffering PTSD symptoms again?
I think that it's very likely to be the case because once you develop PTSD, that means you are very susceptible to the situation, right? You are easily induced. As I said at the very beginning, only 1/3 of people develop PTSD going through the same procedures, the same exposure. So you're vulnerable to certain conditions, environment, maybe a different trauma will trigger a problem. So different traumas, you're vulnerable to get into this situation. I think that's one thing that's hard to modify. We can only deal with specific trauma for the time being. It does not prevent you to have another problem.
I see. Well, Dr. Liu, thank you so much for taking time to tell us about your work.
Thank you for inviting me to the show.
My guest has been Dr. Chunyu Liu, a professor of psychiatry and behavioral sciences at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.